Most people, but not all, are aware that in 2017 we passed major tax legislation that gave everybody in America tax relief. It boosted our economy. And let me just say, it made us the strongest economy that we've had in years. Eliminated all of those companies leaving the United States, gave every single American a tax increase, and just the unemployment rate went down. The average income of every family went up. Employment went up, of course, and we had a really great economy until COVID hit. Those tax cuts are now expiring because the procedure by which we have to adopt them requires a reconciliation process, which I won't use our time up on, and they can only last for 10 years if we do them that way. It was the only way we could avoid the filibuster. Well, they're now expiring, and if they expire, there will be a $4.3 trillion tax hike on America. And $2.6 trillion of that will fall on people in the medium, in the middle income, the lower income, and higher middle income brackets. People making less than $400,000, but really most of them making less than a couple $100,000. $2.6 trillion tax increase. On top of that, small businesses across America will lose the Section 199A pass-through income, and every one of those knows what I'm talking about. Small businesses will see a 20% deduction loss, and it just goes on and on and on. We will have a terrifically negative hit on our economy, which some projections say will reduce our GDP by 1.1%, which is a massive amount of reduction. So we are working to extend those now, and it is a political fight. We are in the center of that fight right now, and it's going to, the Democrats won't help us because they say that those tax cuts are tax cuts for billionaires. There are tax cuts in there for people in every income category, and we may or may not extend every single thing in exactly the same way. But like I just said, the vast majority of this is for lower, middle, and upper middle income families in America. The average family in Idaho will probably see a $2,400 to $2,600 tax increase if we don't do this. And it's just a critical thing to get done.
That's a strong case, obviously, for extension. A concern that some in the hospital industry and some in the medical industry have is, hey, look, let's say we can figure out to keep these extensions going, an extension to the tax cut. What will that cost, right? Is it going to cost in other programs like Medicare and Medicaid, or like you have hospital industries in other states that have been losing hospitals? Idaho has been able to hang on to them, but I think it's like Kansas lost roughly 20% of their hospitals, and again, that's a big concern. If Medicaid and Medicare, take a hit, then that will be a real crisis for our hospital association. So do you anticipate being able to maintain these really fundamental social programs, excuse me, as they're funded today, and still maintain the tax policy?
The short answer to your question is absolutely yes, we will maintain them. There will not be cuts in Medicaid benefits, and there will not be cuts in other hospital or healthcare benefits in the federal healthcare system. Let me give the broader answer, though.
Yes.
If these tax cuts were to expire, as I said, there will be a $4.3 trillion tax increase. The people who don't want us to extend them are saying that we will then have $4.3 trillion of tax revenue, new taxes on people, and that we could use that to reduce the deficit. And therefore, by extending these tax cuts and keeping the law as it is, we will actually be increasing the deficit. That's just a totally false argument. The tax rates, if we extend these tax cuts, will be the same tax rates the day after as the day before, because we will simply extend current law, and the revenue coming into the Treasury will be the same the day after as the day before. But we're having this fight. In that fight, there is a possibility that some reductions in spending will be accomplished to satisfy people who think that not increasing taxes is the wrong idea. So there is discussion of finding a lot of offsets to help reduce spending in the federal system and reduce the scope and size of the federal government. And that's where the argument is thrown out, well, you're going to go cut Medicaid. There are some serious elements of fraud, waste, and abuse in our Medicaid system. And I believe that we probably will end up looking at some kind of waste, fraud, and abuse, but it will be nothing that reduces the benefits in Medicaid to people who are qualified for it today and want to be sure that their qualifications don't extend. And President Trump has made this clear. He's told Congress that he will not sign a bill that reduces Medicaid benefits. And so how do we do that? Well, let me just give you one example. There are a number of examples, but right now, those who are illegally in the country, and we're talking about millions of people,
Sure.
many of them are being signed up to be put onto Medicaid. And we believe that they do not qualify for Medicaid. They're not American citizens, and they are not here legally. And if we were to reduce the provision of Medicaid benefits to those who are illegally in the country, that would be what many consider to be not a cut to true benefits of Medicaid, but instead a reduction of what is considered to be fraud on the Medicaid system.
Sure.
So some things like that could be done. But that's the kind of thing I'm talking about that are under consideration. And even that is not a done thing yet. It's just that there are a lot of ideas about how can we improve the performance of all of our federal agency systems and all of our federal programs and save money doing it by eliminating the waste, the fraud, and the abuse. And there could be some significant action in that zone.